we're gonna have some people report out right quick. I know we have 10 minutes here, but this is a great time to kind of discuss, one thing that may have come from your group that kind of stood out, or an action item or something like that, something you want to concentrate on. Anyone wants to take first dibs here?
Yes, I'm actually here with my boyfriend, Greg. He definitely has something to say as well.
I think mentorship with high school students and tying that to grocers that potentially come into the city, and incentivize it with tax breaks, but also make them promise to involve people from the community in the management structure, and expose these youth to this business model so they become informed
There
and
you
can
go.
go to open their own.
There you go. There you go. Your boyfriend's a smart man. He's talking about putting people in the pipeline. If you put them in the pipeline, you're going to know what you're going to get in 4, 6, 8 years. Now you got a vehicle. I mean, education is a wonderful thing. Yes, I'm for a motor company. We know what we're going to get. We know 2 years, 4 years, and we know what disciplines they're going to be strong in. Because we put them in the pipeline years before you see a guy walking from building 3. We tagged that kid in middle school.
Anyone
Sports doing it all the time.
This is wonderful. I think this is great. Anyone want, Lisa, you got your hand raised? You want to go next?
Yeah, I'll jump in. Our group was really talking about a similar thing, engaging the community, getting community input, and the challenges of getting people's input when they're so busy, meeting their basic needs, that it's very difficult for them to come to the meetings, and that we need to make it possible for them. They're kind of doing a job by the way that they're reporting to us on what the community needs are. And so there should be compensation for that job to make it possible for them to be able to come to the meetings and give the input. And Bree's got our notes if she wants to chime in on anything else. That there was a lot of talk about the community aspect.
Yeah, I think that was a pretty good representation of what happened in the group, and maybe just one additional piece that I cannot recall her name at the moment, but she can represent herself if I misspeak. Thinking about all the other contextual pieces of a person's behavior and why they might be showing up, and just keeping that in mind was, I thought, another important piece that also was brought forward by the individual who spoke about community engagement.
Thank you. Thank you. I see Nadia, your hand is up, and then we'll have Felicia next. And then
we had a great discussion in our group. We started with where do you start? Basically, the question was, where do you start with the communities? And people suggested to reach out to the local government, try partnership with the university and organizations. And some people also suggested to partner with the churches, local community networks. And then there was a question about lack of urban farms, and like we can improve in that area, we can make more. So someone suggested to reach out to the land bank in Detroit and ask for, like, as we were discussing about the pandemic and all those things, so we can just reach out to them. So in the end, we were discussing about like how to, as we were discussing about like how we can communicate and partner with universities and organizations, how can we improve that? So someone suggested to survey communities to better understand the needs of the community, basically, and what we need, what will be the barriers and facilitators. So to start with the survey from the community, what the needs are, and that we can start from there, basically.
Oh, wow, that's great. Thank you, Nadia. Wonderful. All right, Shamika, how about you?
Hello. So our group actually came up with quite a few action items, but I'm just going to pick one for the sake of time. One of the action items we thought about was education. And when you talk about education for food preparation, you know, we talked about the cost of food, and sometimes, you know, people may feel like it's easier just to, you know, grab McDonald's because you can get $1 hamburger or something like that. But education on, you know, you can prepare a meal for $10 or $15, and this is how you prepare these vegetables, or this maybe something, you know, for instance, for me, I really didn't grow up eating a lot of vegetables. I eat vegetables now because it was something that I made a decision as an adult. So, and I don't think it was because my mother didn't want the best for us. I think it was she did what she could. So I think if we start to educate people on how to prepare these foods, how to make nutritious meals, and still be within a budget, I think that may help. Another thing we talked about was with Mr. Mosley and the Detroit Food Coalition, not even knowing that these programs existed, and just kind of pooling our resources. And I know me personally, I work for Detroit Wayne Integrated Health Network. I'm going to reach out to both of those people just to find out how can myself and my organization help you. Like, how can we help you? What can we do? Like, what things can we do to collaborate on some things?
Yes, that's what I'm talking about. And I want to say this to all of our speakers. If you have resources that you want to share with our audience, we're going to put together a resources page. We're going to have one from last night's discussions, and also tonight's and tomorrow's too. So I'm pretty sure you guys have a lot of resources. I see a lot of links that were placed in the chat box, but we really want people to have a page or whatever to get to, so they can look at these resources at their own convenience. Okay, Felicia, you're up next.
All right. So in our group, one of our action items was to increase SNAP dollars, so that these dollars can be invested into the local economy, with money saved by families participating in the program. And our second action item kind of goes along with what we talked about at first, with encouraging like younger people and getting involved earlier. But also supporting programs that offer support for people to learn how to grow produce and enter into like an entrepreneurship programs to help sell excess produce that they grow.
Awesome. Great ideas. Sean.
Hey, how's it going, everybody? Just a quick report from our group. Again, we had a wide variety of voices in our group here, but one of the things that really seemed to stand out at the beginning was just a general lack of understanding of the concept of food as medicine. There was a gentleman in our group who works with populations that have HIV, and nutrition was exceptionally important to those populations during the pandemic. And there were groups that were able to step up in that moment, which is very good. But education sure seems to be something that we would like to see more of, not necessarily formally. Informal education can work too. Would it be nutrition education, cooking classes? There was a post in the chat just recently about that being an opportunity to build community and to share knowledge. And I had to jump in within that presentation because I formerly worked with MSU Extension, and that's what we did. We did the health classes, we did nutrition classes, diabetes education. We offered these to places to people that we were hoping needs it, but that also led into the next inevitable topic, which is money. I think one of the things that we found was identifying both public and private grants that could help to increase funding that could help with education and other resources would be something. Also, when it comes to recruitments for volunteers, is to find the kind of people that actually have the skills to be able to go out and procure funds from other people, because it takes a different cat to do that. So we could have got a lot more if we had another 15 minutes, but we all came to the realization that education is something that can affect everybody at all walks of life, and is something that would be worth investing in more.
Thank you, Sean. We got 2 more people that's going to make comments, and I want to be respectful to everyone's time. If you have to hop off, please do it. It's going to speak for a couple more minutes. I do want to say one thing though. What I did, and Sean, about this economic thing, I think what needs to be involved is the mayor and also the Detroit City Council and getting this going, because it's a shame that there's a whole neighborhood that doesn't have, you know, any access to grocery, but there's 3 marijuana dispensaries there. Something needs to be done. So lobbying them, making sure we put pressure on our politicians to bring people here would be a great idea. So Vicky, please, Dr. Sapp, unmute yourself.
I saw that Rochelle hand was up. I'd rather her speak than me.
Okay. All right, Rochelle.
Well, Vicky, I'll go very quickly. We had a few things that we talked about. Youth engagement was one of them, but transportation was a very big thing that we talked about. And also in finding out the solutions with dealing with the problems of systems and the systems that also need to be in place, and proper advocacy and education. I'm done, Vicky.
Thank you, Vicky.
Wonderful. Thank you so much. One of the things I wanted to say, and I hear a lot of echoing of education and cooking classes and things like that. And one of the things I want to say, with any of the things that we are doing, if we can please make sure that it is culturally relevant pedagogy, because that's where I see a lot of programs fail. Because if you're going to strip me of my culture, then why do I want to learn anything? If you're going to tell me I can't eat my macaroni and cheese, and I can't eat my collard greens, and I can't eat my sweet potato pie or whatever. And one of the things that I said in my group last night, and I should have said it in this one, is the worst thing and the best thing that happened was Patti LaBelle getting diabetes, right? When she was diagnosed with diabetes, right? She had the money to make a book, right? I bought it for my mother and my aunts and all of them. And we began to start cooking foods because, okay, we were like, okay, yeah, I have a PhD, but diabetes, you on your own. I don't know anything about that. But I knew enough to get the cookbook so that we can still keep the culturally relevant foods. When you strip people of their culture, they're not going to do it. They're just not. And yeah, that's all I wanted to say. Make sure that everything we're doing is culturally relevant, and it'll be very helpful for people to continue to do it.
Thank you.
People their culture.
When I do nutrition classes, that's what I do as well. Talk about that, make sure that, because a collard green is just as nutritious as a kale. So,
absolutely.
Yeah. You just have to know how to cook it.
That's it.
Make sure that you keep that flavor.
Yeah.
But that it doesn't have the adverse impact on your health. Thank you so much. This was wonderful. Thank you.
Thank you for participating. I know Dr. Sapp is not a Detroiter. She's not in Detroit, but she, you know, she's bringing her knowledge and everything to us. So we appreciate that, and we appreciate you being here. Anything else? Because we're going to wrap this up. We are going to wrap this up, and I'm going to give the mic back to my counterpart, Lisa, here, so she can close us out today.
Sure. So thank you everyone for joining us, and especially thank you to all of the speakers, Winona, to Alex, to Mr. Mosley, and thank you all for participating and contributing your genius to the breakout rooms. We are certainly going to collect all of the notes that we have taken. And like Dr. Thompson said at the beginning of this is just the start. This is not where it ends. We are in night 2 of this symposium, and hopefully you all will be able to join us tomorrow evening at 6 p.m. As we close things out. We're going to have Dr. Carrie Leach on the agenda, in addition to a few other wonderful speakers to talk about another important topic, the digital divide. So I'm sure that this is something of great interest to everyone who joined us for tonight. And so hopefully you are able and available to join us for night 3 and to close this thing out. And of course, are committed to continuing the conversation, as well as to actually put into practice, put into implementation some of the things that we talked about tonight and yesterday, and the things that we're going to discuss tomorrow. So again, thank you all for joining us, and we will conclude for the evening. Have a good evening, everyone.